At UT Health Houston, we hope that our health professions trainees who go through the poverty simulator will come out of it realizing that poverty is reality and that they are empowered to make a difference for their patients, not only within the healthcare delivery system, but outside of the system within the community as well.
I hope their biggest takeaway is to have empathy for those that aren't as fortunate as they are. Today during the simulation, they really have walked in others' shoes. Our hopes are that if they understand some of the barriers to healthcare for those less fortunate, that they will, in their practices, promote better equity for healthcare for everyone.
Well, I think this group is particularly engaged. I can hear lots of conversation. They're really getting into it, maybe some theatrics going on in there, so I think they're really enjoying it. I hope that it will give them the perspective, all joking aside, that this really is something that their patients are dealing with. And I even overheard a conversation where one young lady was talking to her loved one on the phone about, in order to qualify for this program, we have to have childcare. We're not going to be able to pay our utilities this month. And being very mindful that when you prescribe a medication that may be a $300 out-of-pocket cost, or maybe even more than that if the patient is uninsured, that may not be a possibility for them to get that. It's not a lack of caring for their own health. It's having to pick and choose what resources they and their family can afford and which ones they can't.
I think it's a fantastic opportunity for the community partners as well as the healthcare professionals. I've seen how they've reacted to the simulation and what they're facing just within this 1 hour. And so for them to be able to take that feeling back when they're facing and interacting with their patients, I think they'll have a better understanding and just be a better healthcare professional.
If you are a Houston community individual, business, or agency who shares in our vision for training the healthcare professionals of the future, please contact us.